Hi, welcome to my presentation about alogliptin. Alogliptin, also known as Nesina, is a medication that belongs to a class of drugs known as dipeptidopeptidase 4, or DPP4 inhibitors. It is primarily used in the management of type 2 diabetes. Alogliptin may be prescribed alone or in combination with other diabetes medications such as metformin or insulin, depending on the individual's specific needs. Alogliptin works by inhibiting the activity of the enzyme dipeptidopeptidase 4, or DPP4. This enzyme is responsible for breaking down incretin hormones in the body, specifically glucagon-like peptide 1, GLP-1, and glucose-dependent insulinotropic polypeptide, or GIP. Incretin hormones are released in response to food intake and play a crucial role in regulating blood sugar. By inhibiting DPP4, alogliptin prolongs the action of incretin hormones, leading to increased insulin secretion and reduced glucagon production. Pharmacodynamics of alogliptin. Alogliptin is a medication that is administered orally in the form of tablets, therefore allowing for rapid absorption. This medication is absorbed from the gastrointestinal tract and reaches peak blood concentrations within 1 to 2 hours. Alogliptin has high bioavailability, approximately 100%, which means that a significant portion of the drug that is ingested reaches the bloodstream. Alogliptin has a relatively small volume of distribution, indicating that once ingested, it remains primarily within the blood and does not extensively penetrate tissues. Alogliptin is highly protein-bound, with approximately 20 to 30% of the drug binding to plasma proteins. This protein binding is relatively low, which can reduce the potential for drug interactions involving displacement from protein binding sites. Alogliptin undergoes minimal hepatic liver metabolism, which is primarily metabolized through a non-CYP450 enzyme pathway known as hydrolysis. Alogliptin and its metabolites are primarily excreted by the kidneys. About 60% to 71% of the drug is eliminated in the urine, while the remainder is eliminated as metabolites. The elimination half-life of alogliptin is approximately 21 to 28 hours. Alogliptin is an anti-diabetic drug, meaning after ingestion, the drug exerts a pharmacological effect by inhibiting the enzyme dipeptidopeptidase 4. DPP4 is responsible for breaking down incretin hormones. By inhibiting DPP4, alogliptin increases the level of intact GLP-1 and GIP in the bloodstream. These hormones have several beneficial effects such as enhanced insulin secretion and inhibition of glucagon release. Alogliptin's primary therapeutic effect is the reduction of blood glucose levels in individuals with type 2 diabetes. This reduction occurs mainly through increased insulin secretion and reduced glucagon levels. Treatment with alogliptin is associated with reductions in hemoglobin A1C HbA1c levels, which is the overall aim in managing type 2 diabetes. The glucose-lowering effects of alogliptin are dose-dependent, meaning that higher doses are associated with more significant reduction in blood glucose levels. A study was conducted where individuals with diabetes were placed under alogliptin treatment, and within the first 6 months, HbA1c decreased from 7.37% to 6.78%. This study proved the efficacy of alogliptin, as it shows that glucose levels were in fact decreased during alogliptin treatment. Alogliptin has many physiological effects. Most importantly, it helps lower blood sugar levels by increasing insulin secretion and decreasing glucagon production. The medication also enhances the release of insulin from the pancreas in response to elevated blood sugar levels. Alogliptin may also slow down the emptying of the stomach, which can help reduce post-meal spikes in blood sugar levels. The effects of alogliptin can vary from person to person, and its use should be under the guidance of a healthcare professional. Additionally, like all medications, alogliptin can have side effects such as cold-like symptoms, headaches, stomach ache, diarrhea, rashy or itchy skin. Although adverse effects to alogliptin are uncommon, there is still a chance for serious side effects such as severe stomach pain, which can be a sign of pancreatitis, otherwise severe eyes turning yellow, which can be a sign of liver problems. So it is essential to discuss its use and potential risks with your healthcare advisor. Alogliptin is a Schedule IV prescription-only medication, which implies that the pharmacist is only allowed to dispense this medication with a valid prescription from an authorized prescriber. The prescribers of alogliptin can include doctors, nurse practitioners, midwives, and even endocrinologists. Counseling for Alogliptin can be provided from diabetes educators, who can be nurses or dietitians, pharmacists, registered dietitians, mental health counselors, psychologists, psychiatrists, and nurse practitioners. Counseling for Alogliptin, like counseling for any other medication, is an important aspect of patient care. When counseling a patient to prescribe for Alogliptin, healthcare professionals such as doctors, nurses, or pharmacists should provide information and guidance to ensure the patient understands how to take the medication safely and effectively. They must be able to explain the purpose of Alogliptin, which is to help manage blood sugar levels. It is helpful to instruct the patient on the prescribed dosage and the recommended timing of Alogliptin. Additionally, it is helpful to explain how to take the medication, whether it should be swallowed whole or it can be crushed or cut. Most importantly, it is crucial to discuss the common and rare side effects associated with Alogliptin. Inform the patient about any severe side effects, such as an allergic reaction that requires immediate medical attention. Schedule follow-up appointments with the healthcare provider to monitor the patient's progress, adjust the treatment plan if necessary, and address any concerns. And lastly, it is important to encourage the patient to ask questions and voice any concerns they might have about Alogliptin. Ensure they have contact information to reach the healthcare provider or pharmacist for further assistance. Some quick questions. What hormone does Alogliptin prolong in the bloodstream? Is it A, testosterone, B, incretin, C, estrogen?